Blood clots are an essential mechanism in the human body, preventing excessive bleeding when injuries occur. This process, known as coagulation, involves the transformation of liquid blood components into a solid state. Clotting factors, a series of proteins, are activated in a cascading sequence to form fibrin, a fibrous protein that stabilizes the clot. While blood clotting is crucial for healing, clots can sometimes form inappropriately within blood vessels. When a clot develops in a vein, it is known as a thrombus. If a part of this thrombus dislodges, it travels through the bloodstream as an embolus. This transformation from a stationary clot to a moving embolism is a significant medical concern. Pulmonary embolism, PE, occurs when an embolus lodges in the pulmonary arteries in the lungs, blocking blood flow. This can lead to severe respiratory distress and is often life-threatening. Deep vein thrombosis, DVT, typically forms in the deep veins of the legs. If a part of a DVT breaks off, it can travel to the lungs, causing a PE. Arterial embolism involves emboli traveling through arteries, potentially blocking blood flow to critical organs such as the heart or brain, leading to conditions like heart attacks or strokes. Several factors can contribute to the formation of clots and their progression to embolisms. Immobility, prolonged periods of inactivity, such as long flights or bed rest, can slow blood flow and increase clot risk. Surgery, major surgeries, particularly those involving the legs or pelvis, can increase clot formation. Medical conditions, certain conditions, like atrial fibrillation, cancer, and inherited clotting disorders, heighten the risk. Lifestyle factors, smoking, obesity, and pregnancy also contribute to the risk of developing clots. Symptoms vary depending on the location of the clot or embolism. DVT, swelling, pain, and redness, usually in the legs. PE, sudden shortness of breath, chest pain, and coughing up blood. Arterial embolism is symptoms related to specific organ blockage, such as heart attack, chest pain, arm pain, or stroke, sudden weakness, speech difficulties. Diagnosing a thrombus or embolism typically involves imaging studies, such as ultrasound for DVT or CT scans for PE. Blood tests that measure clotting factors, like D-dimer, can also be indicative. Treatment aims to prevent the clot from growing and to reduce the risk of embolism. Anticoagulants, medications like heparin and warfarin that prevent new clots from forming. Thrombolytics, drugs that dissolve existing clots. Surgical intervention, in severe cases, surgical removal of the clot may be necessary. Preventing clots and embolisms involves managing risk factors. Regular activity, encouraging movement and exercise, especially during long periods of immobility. Compression stockings, wearing these can help promote blood flow in the legs. Medications, for high-risk individuals, prophylactic anticoagulants may be prescribed. Understanding the journey from clot formation to embolism is crucial for early detection and treatment, potentially saving lives and preventing severe complications. Regular monitoring and preventive measures can significantly reduce the risks associated with thromboembolic events.